Let's talk about treatment. How do you treat spring allergies?
Well, there are 3 ways to treat allergies. The first thing to do is avoid it, but does that seem practical to you? No, we all enjoy being outside, so avoidance typically is not really effective.
So then we use medicines you can get over the counter?
There are a few available medicines over the counter. The difficult part for that for patients is they don't know what to pick up. Do they need a pill? Do they need a nose spray? It's confusing.
So what are some of the things that you prescribe for people that are having allergic hay fever, allergic rhinitis in the spring of the year?
Typically I start with an antihistamine, which is a tablet that you take by mouth, and then we move on to nose sprays, and those can be nasal steroids or nasal antihistamines, even a combination that's out now.
So you've got pills and sprays. Let's talk about the pills. Let's talk about the antihistamines. What do they do for the allergic reaction?
Typically, they just dry up the itching and the runny nose.
So the congestion, the blocked head, I can't breathe, all those stuff, it doesn't help as much.
That's not going to help.
So
no.
what do you have to use for that?
Then we move on to the nasal steroids and the nasal antihistamines, the nose sprays.
So there are antihistamine nose sprays?
That's right.
And so they'll put the antihistamine on the nose?
Right on the nose.
Right where you want it?
That's right, and very effective.
And tell me about the nasal steroids.
Now those also are deposited right on the nose where they're needed. The difference is they have to be used several days in a row before seeing a real benefit, and that can be frustrating for patients.
Sure. Now, are some of those medicines over the counter, the antihistamines?
Yes.
And the steroid nasal sprays?
There are a couple out now, yes.
So if we've got Nasacort and Flonase that are over the counter, and you use those, how does the patient know how to use them?
Well, if the patient hasn't been into a physician's office, they may not know how to use them.
So you mentioned the steroid nasal spray may take 2 or 3 days to work, or 3 or 4 days.
That's right, or up to 2 weeks for some patients.
Are there some problems with the steroid nasal sprays? Do you get nosebleeds with them?
You can get nosebleeds. Some patients have headaches, and I've seen even more severe complications in patients who were not followed by their doctor while using a nasal steroid.
So what about the antihistamines? Are they dangerous?
They are fairly safe. They have a good safety profile. The problem is the side effects that are just bothersome to patients. They can make you feel more tired than the allergies sometimes.
So if you have the patient in the office and they tell you that they've tried an antihistamine over the counter, what is going to be the first thing that you're going to prescribe for them in your office if their nose is all swollen and it looks allergic and their eyes are red? Let's talk about eye drops and let's talk about nose medicines.
Sure. So there are eye drops that are available both over the counter and by prescription, and they are called ocular antihistamines. They're typically used once or twice a day, and they provide fair relief of the eye symptoms.
Do they sting or itch, or they take away the itching?
You know, when a lot of patients complain that when they first feel the drop go in, there is a momentary itching or stinging.
Okay, and so those work pretty good.
They do.
Any names, Zaditor, Opcon A?
Yes, those are some of the ones that are available over the counter, and by prescription, Patanol or Pataday.
Okay, and the steroid nasal spray that you would prescribe in your office would be?
Something like Nasonex or Omneris. Those are a couple of the more popular ones.
And you mentioned there's a combination because
yes.
This has really been an innovative thing. Tell me about the combination.
The combination is called Dymista. It combines both a nasal steroid and a nasal antihistamine. So rather than using 2 sprays twice a day, you can use 1 spray.
And does it work just as good?
Absolutely, it works just as well.
And that's called Dymista. So we've
Yes.
got a Dymista spray. Let's get into the only way to get rid of allergies. Is there a way that, I'm sick and tired of allergies every spring. They're driving me crazy. I can't perform. What can I do? I've tried medicines. What else is there?
Your best chance for a cure is immunotherapy.
Now, what is immunotherapy?
Immunotherapy typically is allergy shots done under the guidance of a physician.
Okay, so these are allergy shots. What are in the shots?
The shots actually contain the allergens to which you're already allergic. There are no medicines, no steroids. Parents are concerned about what is in these shots, but actually it's very natural.
So when you did the skin testing, you found out which allergens. Are those the allergens you picked to put in the...
That's exactly right.
So you use those for the immunotherapy. Do you have to start at a real strong dose to see how they're going to do, or at a weak dose?
Actually, we start at a very low dose so that it's very safe for the patient, and we build up those doses over time so that your body develops a tolerance through the immune system to the things that you're allergic.
So how often do you have to come and get these shots?
Once or twice a week in the beginning, in the end, once a month.
So when you're getting your shots, they inject into the hip or the leg or the arm?
The upper arm, actually.
In the upper arm. And so when they inject into the arm, the immune system does what?
Well, the immune system immediately recognizes the antigen and slowly over time will build a tolerance for the patient.
And when the tolerance means what?
The tolerance means that your body is no longer bothered when it encounters those antigens. So when you inhale those spring pollens, your body doesn't respond by going haywire and making all those terrible symptoms for you.
Does it usually take 1 year or 2 years or 3 years for that to happen?
Oh, actually, we start seeing results with immunotherapy in as little as 4 months.
So when you're injecting into the arm what they're allergic to, you build up tolerance to it, where when you breathe in the oak pollen or the pollen that's out in the air, it doesn't bother you. It doesn't cause the runny nose, sneezing. Don't have to take medicines.
That's right. Most patients see that they need no medicines eventually, but definitely a reduction in the medicines that you would need.
When somebody has multiple trees and grasses, can you combine them all, or do you have to give a shot for each tree?
Oh no, we combine several. Some patients need 1 shot, some patients may need 2 or 3 when they go in.
And when you start off twice a week or once a week?
Typically we start off twice a week, but even if you can get there once a week, that's a good shot.
And when you reach your big dose, the maintenance dose,
Yes.
Do you take them once a week for?
Typically 9 months to a year. You and your doctor will decide on that.
And then you go to
Every other week, then every 3 weeks, and like I said, eventually once a month.
And so is there any other way to get rid of the allergies?
That's the only way that we have found to really rid ourselves of the allergies.
So if somebody has hay fever in the spring and they don't respond to medications, then they should see a board certified allergist
Yes,
and get started on immunotherapy, the only way to get rid of it.
that's right.